Continuing on, the heart receives its blood supply from the coronary arteries. As you can see on this slide, the aorta is ascending out of the left ventricle, and immediately the coronaries branch off of it to feed the heart muscle. Many people confuse this process with the rest of the body and think the heart receives blood in some other way, but it doesn't. This is it. The circulatory system works the same here as it does in the remainder of the body. The right and left coronaries become smaller, and arterioles branch from them and exchange that all-important oxygen in the capillary beds, then return via venules and veins. But instead of going into the vena cava, like all the other deoxygenated blood in the body, the coronary veins deposit directly into the right atrium. This slide reviews the circulatory system. A new concept to learn is cardiac output. Cardiac output is the amount of blood ejected through the heart. The heart is a demand pump. It only pumps what it receives. So if it was determined necessary to measure the cardiac output of a patient's heart, where do you think we might perform that task? The correct answer is in the right side of the heart, because that is where all of the blood is received. And then it continues on into the lungs. This diagnostic procedure is called a right cardiac catheterization, and a small catheter is inserted in a vein on the arm or leg and travels to the right ventricle to measure the amount of blood received by the heart over a period of a minute and pushed into the lungs. When you are studying this slide, add the additional names for the AV valves that you learned 2 slides ago. This slide is the one that I've been alluding to for several slides. This is the myocardium's slide. First and foremost, you have to learn that the heart beats because of electrical stimuli generated within the specialized muscle cells of the heart. Remember from earlier when I said the heart is a hollow muscular organ and that the type of muscle was very specific? It is cardiac muscle, and it's completely unlike the other 2 types of muscle in our bodies. Quick review. What are the other 2 types of muscle in our body? You can bet I'll ask you this during our review session. The cells that compose the cardiac muscle are capable of generating electrical impulses. These impulses travel a specific pathway through the heart in order for the heart to beat in a regular, coordinated way. The impulses begin at the sinoatrial node, which we call the SA node for short. The SA node is also known as the body's pacemaker. The SA node is located in the right atrial wall. Okay? Remember, we've got right atrium, right ventricle, out to the lungs, back into the left atrium, left ventricle, into the aorta, and to the rest of the body. Okay? So right here in the right atrial wall is the body's natural pacemaker, the sinoatrial node. From the sinoatrial node, the impulse travels to the AV node. So here's sinoatrial, and then it travels to the AV node, atrioventricular node. The AV node lives in the intraatrial septum. The intraatrial septum is right here, the septum dividing the atria. Okay? Then the impulse travels from the AV node down the intraventricular septum so the wall dividing the ventricles, via the bundle of His. All of that is the bundle of His. It's named after a Dr. His, okay? In the image, it looks like these impulses could be intracardiac vessels, but they're not. Think of it like an electrical fence traveling through the heart. These structures are not transporting blood, but rather electricity. Once the electrical impulse reaches the bottom of the ventricles, they wrap around the ventricles on each side, to the right and to the left. These then are called the right and left bundle branches. This impulse is now in the ventricular walls, right here. There's a difference between the septum and the walls. All right? So now our electrical impulse is in the walls, specifically in the walls of the ventricles on both sides. Once it gets to these walls, it branches one last time into the Purkinje fibers. Once the impulse reaches the Purkinje fibers, the heart will contract. It was always helpful to me to understand the location of the impulse when studying this process. Knowing the difference between the atria and ventricles first, then knowing the difference between the walls and the septum helped tremendously. We won't be meeting people whose conduction system is working. We're going to meet those who have disease or interference in the conduction system. An improperly functioning conduction system results in uncoordinated electrical activity of the myocardium, aka non-effective heartbeat. As you can read on this slide, most diagnostic procedures take place in interventional radiology, and a surgical technologist may assist in the procedure. A variety of cardiac function tests exist and require sophisticated imaging techniques, angiography, and stress tests. Routine lab tests are performed to identify abnormalities of cardiac enzymes in the blood. Now this one's a bit of a busy slide, so we're going to go through it bit by bit. We've recently scratched the surface regarding right heart catheterization. So now let's finish that piece of information. First, cardiac catheterization is an interventional radiology procedure. A catheter is inserted into a heart chamber and large vessel via peripheral artery or vein. The purpose of heart catheterization is to assess the heart chambers and vessels. Notice how there are left heart catheterizations and right heart catheterizations. We already know the blood is different in the right side of the heart versus the left side of the heart. Right heart blood is deoxygenated. Left heart blood is oxygenated. So since we already talked about right heart catheterization, let's continue there. The right heart is filled with deoxygenated blood, and deoxygenated blood travels through veins. So our access point is a vein, right? The goal is to assess the cardiac output, or how much blood is received and pumped through the heart in a minute. The left heart catheterization will assess the left chambers, the aortic arch, and most importantly, the coronary arteries. The access point for a left heart catheterization is going to be where? A left heart catheterization is performed more often than a right due to the need to assess the function of the coronaries. And we remember why the coronaries are so important, right? The diagnostic procedures remaining on the slide include cardiac imaging, intravascular ultrasound, oxygen saturation, and cardiac muscle biopsy. Cardiac imaging is very much like angiograms we studied in peripheral vascular, only they're looking at the chambers of the heart to view the movement of blood through the valves of the heart. Intravascular ultrasound is different from conventional ultrasound in that the ultrasound wand is actually attached to the catheter tip itself and then guided through the arteries to your coronary arteries. It picks up sound waves and transmits them into an image on the screen. This is different than an angiogram because the angiogram shows strictures and aneurysms and such. But an ultrasound can show the walls of the artery. It can show plaque buildup if it's there. It can show the effectiveness of a stent. It can give a better idea of what's going on inside those arteries. This type of analysis can also be conducted in the heart itself, and that's an echocardiogram. Oxygen saturation is measured on every patient, every time, by using the SpO2 monitor on their finger. It can also be measured by performing an arterial blood gas, which we learned about in pulmonary, in which blood is aspirated for an artery, not a vein, and measured for oxygen saturation in the blood. This is a big deal in cardiac procedures because sometimes oxygen saturation tests are performed as a component of these other tests to see if there's shunting taking place between the heart chambers. We remember that deoxygenated blood is in the right heart and oxygenated blood is in the left heart. But what does it mean if we find deoxygenated blood in the left heart? It means there's shunting going on somewhere, a hole or an anomaly in which right heart blood is getting into the left side of the heart without first going through the lungs. Finally, cardiac muscle biopsy is performed to test whether the tissue is potentially being rejected post-transplant. I think that one speaks for itself.